sempozyumumuz hakkında kısaca bilgiler vermek istiyorum. Sempozyumumuzda gördüğünüz gibi bir sektörel alan var. Bir de canlı yayınların yapıldığı, toplantının gerçekleştiği bir alanımız var. Bu alanda sadece Cristina Magli'nin konuşmasına has yabancı çeviri oldu, canlı çeviri oldu. Bundan sonra tek kanal gideceğiz. Ve webinar olarak yabancı katılımcının olduğu diğer webinarda ben ve değerli arkadaşım Başak Balaban moderatörlük yaparak o webinarı sunacağız. Öncelikle şunu söylemek istiyorum. Bu toplantı bir zaruretti. Bu zarureti gerçekleştirirken de birçok destek aldık ve Türkiye'de de bir ilki belki yaptık. Çünkü bakanlık da bu konuda, Sağlık Bakanlığımız da bu konuda oldukça temkinli davrandı. 1,5 aya yakın bir süreçte ancak bu olayı gerçekleştirebildik. Şu anda önümüzdeki süreçte panellerimiz var. Moderatörlerimize sorular sorabileceksiniz. Moderatörler de soruları panelistlerimize verebilecekler. Ben tekrardan katılımınız için çok teşekkür ediyorum ve artık panelimize geçebiliriz ve çok heyecanlı bir panel izleyeceğiz. Ardından 2 tane gene çok güzel sunum var ve ardından da son panel bence en önemli panellerden bir tanesi. Orada da hem temel infertilite bilgilerimizi gözden geçireceğiz hem de güncel gelişmeler ışığı altında şu anki pratiğimize bir bakış yapacağız. Tekrar tüm katılımcılara teşekkür ediyorum. Çok kıymetli bir bilim insanıyla yapıyoruz. Cristina Magli kendisi Eshre'nin yani Avrupa İnsan Üremesi Derneği'nin başkanı ve gerçekten de çok kıymetli bir bilim insanı ve yoğun mesaisi arasında bizi kabul etti ve burada kendisi de bizimle ilk açılış konuşmasını yapmayı uygun gördü. Biz de bunu büyük bir keyifle izleyeceğiz. Bütün katılımcılara ve bileşenlere ve bu sempozyumu altyapısını, desteğini veren Serenas grubunun online merkezindeki çalışan arkadaşlara şimdiden teşekkür ediyorum. Bir takım problemler olabilir. Çünkü ilk defa Türkiye bunu deneyimliyor. Ama eminim ki güzel geçecektir. Ben şimdi müsaadenizle Cristina ile bir iki İngilizce konuşma yapacağım. Kendisine hoş geldin diyeceğim. Ardından kendisini izlemeye başlayacağız. Cristina, it is my privilege and honor to introduce you to our attendance, and I want to express my gratitude to you that you accept our invitation to our symposium during your very busy schedule. And we will be very happy to hear what will be go on after this pandemic in our field, and we will be excited to hear your good presentation. In Congress, when you are introducing the speakers, we call that the podium is yours. Now I'm saying that the screen is yours. So thank you very much in advance. And because of the nature of the keynote speech, we will not get questions to you, but I know very well that your speech will be very clear, and it will be very fruitful for us. And thank you again, and the screen is yours. Thank you very much.
Well, thank you, Ahmet, for your presentation, and good afternoon to everybody. It is an honor for me to be here, actually. And I am especially happy of this initiative of yours, because I think that this type of actions are the one that demonstrate that we want to be still alive And we still have a lot of desire of learning, understanding, sharing information, even in these very difficult times. It's a sort of reaction that I really take in great consideration. So congratulations to you for having done this step forward. So at the beginning, we were the first in Italy to stop ART activities. It was at the very beginning of March. And then at that point, we, as Eshre, started to refine our initial statement that was just a recommendation of precautions. And in that statement that it was issued on the 13th or 14th of March, we were advising couples not to become pregnant. So of course, our consideration was mainly directed to IVF couples. This was a position that was accepted by many countries, but by others we received some heavy criticism, I have to say that, because we were inviting all couples, all IVF couples, not only those with a sign or symptoms of COVID-19 infection. So we were inviting all couples and all ART centers to suspend their activity. As I said, we were a little bit criticized by some parts, but then also ASRM, the American Society, took the same position. And when I saw that, I have to say that I felt in some way relieved, because it was clear that we were sharing the same concern. And by that time, it was close to the end of March, as Eshre, seeing the number of cases that were increasing, seeing the quantity of information, scientific information, case reports that were starting to be published, and considering the need that we had to learn and to act in a competent way in front of a situation that was totally unknown to us. So then we decided to set up a working group, a COVID-19 working group that was entitled of following especially all the information and the data going around this topic. It was by the beginning of April in which we issued another statement in which we were more strongly determined to consider that ART should not be at all started. And it was certainly due to the unknown effect of the virus on pregnancies, especially on the initial phases of pregnancies. But we were also concerned about the healthcare resources. This condition was especially severe in Italy, where we had a tremendous increase of cases, very sudden and all together. So, of course, for our healthcare system, although very good system, it was a real challenge. Of course, we consider the exception for the urgent fertility preservation cases. Then time went on, and you know that the situation started to stabilize a little bit. So some countries restarted activities, and then in consideration of the distant plateau that was already appearing in the curve of infections, then we consider that it was the time to return to ART activities. So this was a position that was sent out by Eshre and by ASRM practically at the same time. I mentioned a couple of minutes ago that we have this special working group on COVID, and actually I have to acknowledge them for all the activity that they have done. They have done so many things. They have taken care of the majority of statements, They have kept track of still doing that, of the emerging data in the scientific literature that in some cases have to be very carefully evaluated. They address questions and answers that we continuously receive from professionals and even from patients. They keep track of the situation of the different countries in Europe regarding the activities in the different clinics. They make a case, they organize a case report. I mean that we invited everybody to upload in our website the outcome of the cases, or the cases that they treated during this period of the pandemic, because we want to understand how it is at the end, the incidence of infection that can come out during the treatment of our patients, COVID positive or non-COVID positive, because in some cases there were treatment of COVID positive patients, the one that were considered urgent. And finally, duty of this working group is to release a document on guidance for restarting the activity that is publicly available on our website. And among the people that are in this working group, you will certainly recognize Barış Ata, that is one of the members, and is actually one of the members of the Eshre Executive Committee. So certainly the key priority for the restart of the activities is safety. Safety for the patients, safety for professionals as well. So there is a lot of things that we still need to know. What is the possible effect at the level of reproductive cells? This is especially important for embryologists like me, for us people working in the lab. Do we have any potential risk in treating fluids that maybe belong to patients that are positive or at the beginning of the infection? Is there any risk of cross-contamination to other culture systems, contamination to the operators? And going to the patient, does vertical transmission occur? So is it safe to establish a pregnancy? And are pregnant women at risk of infection or morbidity more than patients in a normal time where no pandemic is around? So concentrating now on the laboratory. Are we at risk? I mean, are embryologists at risk of being infected or transmitting the infection to other culture systems in the lab? Well, there are not many papers published on this respect. Most of them are case reports. As I said before, these case reports have to be very carefully evaluated, because there are some saying one thing and then there is another one saying completely the opposite. So we still have to learn a lot. Regarding sperm samples, there is a report in which it was found that some sperm samples were positive for the RNA of this coronavirus. It was also found that in some spermatogonia, Leydig and Sertoli cells, there are the receptors through which the coronavirus entered the cell. But it's also true that there are other publications in which it was undetected the presence of the RNA in the sperm samples. And what about the embryos, the oocyted embryos? Well, the embryos they have been shown to demonstrate the receptors for the COVID-19 virus and for other coronaviruses. They also have all the machinery that is needed for viral internalization and replication. But of course, the presence of the virus of the receptors does not mean that these samples are infected. So there is no evidence so far that there is any risk for embryologists during the treatment of these of gametes and embryos, especially taking into consideration all the strict quality protocols that we follow according to the IVF guidelines for good practice in IVF laboratory. So this is a good news. Of course, we are very strict, especially nowadays in working in our lab. But to be honest, we don't do anything different compared to what we used to do in the past, before this pandemic, and what we used to do when we work with some patients that are positive for hepatitis B or C or virus or even HIV. Regarding what else? Regarding ovarian tissues, the receptor for the virus are actually expressed in the human ovary. And it has also been found the presence of spike proteins and RNA in a couple of placentas from miscarriages. So if we put all this information together, there is, as I said, there is not much, but it is one of our duties in Eshre, the working group on COVID, to have a complete follow-up of this information, and it is publicly available on our website. So we keep track of this to be sure and to learn more about the current situation. And if we go to the patient, the first question is, are we exposed to a risk of vertical transmission? Again, there are some reports, some infants affected that were born, some infants with antibodies present against the SARS-CoV-2, some cases of placental infections, but you see the numbers are very small, and we can conclude that at the end, at the current stage, there is no convincing evidence for vertical transmission. And actually the same has been shown also for the other coronavirus that were present recently in our world, that is the SARS and the MERS. We were also tracking the situation of infection or morbidity for pregnant women. And also in this case, if we compare to SARS and MERS, you do not see any specific risk for pregnant patients in this reality. So if we may conclude this part of my considerations, I would say that it is true. SARS-CoV-2 may have the potential to infect reproductive tissues and cells, because we have shown the presence of the receptors in gametes and embryos. Nevertheless, there are no convincing data on that, no convincing data on the vertical transmission. We still do not know what happens for the ART outcomes, but we will know if we keep providing data to the national registries and to scientific societies, as Eshre is doing at the moment, as I mentioned before. And it seems that pregnant women are not at higher risk of infection or related morbidity, as well as the obstetric outcome that seems even to be not so severe as it was with SARS and MERS. Nevertheless, I stress again, there is need for vigilance. We need to report our cases. We invite all of you to do it to the Eshre website, where there is a specific box to collect this data, because we want to know what is the outcome, the situation related to ART, because this can be very helpful for us to understand and to prevent, should this situation come back in the autumn, winter, as many virologists prospect, or in cases of other type of infections. Eshre is also making some different pictures of the situation in the different countries in Europe, how it went during this period, because we saw that it was a dynamic situation. At the beginning, the majority of countries were working. Italy was the first one. You see here the development. By March the 1st, only Italy was blocking all ERT treatments, sign indicated by the red color. Then the red color spread throughout Europe a long time. And then the yellow color started to appear. And now the yellow color is more and more there, because gradually the majority of countries are restarting ART treatment. So to do that, as I said before, the important point is to do it in a safe way. Safety is our key word, is our key concept. And how did we thought to do it? I mean, we elaborated a document available on the Eshre website, and we started to consider the following points. Before entering our clinic, we asked everybody to provide us with the triage questionnaire. There are 13 different questions. It is a sort of self-declaration in which you indicate if you were sick, did you have fever, coughing, sore throat, you lost smell or taste, you were in contact with somebody with symptoms, or you were in a very special at-risk reality. Have you ever been diagnosed with COVID-19, or somebody next to you was diagnosed in that way? So in this case, we are aware of everybody that enters our hospital or clinics. And if in case we are talking about patients, because as I said, this is valid for staff and patients, there is also the question number 13, in which we ask if the patient are exposed to a severe medical condition like diabetes, respiratory diseases, or something similar that can deserve a special attention, because the risk of infection would expose them to a very severe situation. So this is what we do normally a couple of weeks before admitting everybody entering hospital and clinics. Should one of these questions in the triage, what we call the pre-triage, be positive, so being answered yes, then we recommend a diagnostic testing. We all know that we have been bombarded by the information, PCR, real-time PCR, serological testing, so we have to be aware of how it works. I mean, just in a couple of words, sorry, I went out. So if we look at the curve, these ones that are the PCR trend when at the start of symptoms, these are the PCR results. You see that there is a period in which these results are informative, that is for a period of a couple of weeks. But then the PCR declines, the PCR results declines, it means they can be negative, but then we can have the information provided, and it is the dotted lines from testing the antibodies, that is IgG or IgM, that can compare, as you see here, at, either together at the same time or one before the other. This is a case report from almost 300 patients, in which it was shown that 100% of them tested positive for immunoglobulin G within 19 days after the symptom onset. And if we look at the trend in the different patients, each of these line is relative to a patient, it is clear how both IgG and IgM titers plateau, so are very high within 6 days after seroconversion. In other words, serological testing may be especially relevant, the information can be especially relevant in cases of suspected patients, the ones that were maybe positive at the triage, and especially those that were asymptomatic at the PCR time. So this is a concept that we have proposed. For the staff, we propose, as I said, a triage questionnaire 2 weeks before starting working. We can have 3 types of results. If the triage is negative, then the staff can start working. If it is potentially positive or with some symptoms, that we recommend testing. If it is definitely positive or some test has been done, of course, the staff is not admitted to work. And for the patient, we have a similar situation. We have the 3 different scenarios. So triage negative, triage potentially positive or mild symptoms, or declared positivity. So if we look at the way we develop these 3 different situations, so in the case of negative pre-triage, we repeat the triage at the moment of treatment, combined with serological testing. If everything is okay, then we can start the procedure, both of oocyte retrieval or embryo transfer. In the case, the pre-triage was negative, so everything clear. But at repetition 2 weeks later, before starting treatment, we have a different situation. So if immunoglobulin M are negative, then even if immunoglobulin G are positive and there are no symptoms, we can go with the standard procedure. But if the IgM were positive, then we postpone the treatment. We can also have the case in which the pre-triage had some positivity for the serological testing. So we follow the same approach. We repeat the serological testing. In case of IgM negativity, we can go on with the procedure. But if they are positive, we postpone. And of course, we postpone in case even the pre-triage was positive for IgM. Of course, if it was positive from the beginning, postponement is the rule. So in this way, we have the tightest control possible for our staff and for our patients. So how to adapt ART services? So there are different strategies, but of course, the key factors are the ones that we are all very aware: sanitation, separate pathways, social distancing, and following the triage results. Regarding the different aspects, for the stimulation monitoring, we go for minimal exposure, reducing at maximum the unnecessary procedure, and of course, using all the protections like facial masks to reduce the possibility of infection. For the oocyte retrieval, of course, going on, it is based on what the approach that we saw before. Of course, during treatment of the patient, the facial masks are obligatory. For the laboratory, as I mentioned before, there is not really a special procedure to follow because we have always been working in a very controlled way. So no special detail that I can give to you. consider that the laboratory is a sort of protected environment because entrance to the IVF lab is restricted, and so no patients are admitted, no partners are allowed. That means that we are very protected from the external world. One thing can be said, that in case we treat patients that are positive, we are talking about the so-called emergency or urgent treatments like oncological patient for fertility preservation, then the only recommendation is, even is probably it is not necessary, but for an extreme precaution, we recommend to cryopreserve gametes or embryos in high security straws and maybe use vapor phase for storage. Then, of course, we follow a minimal exposure of the staff and of the patient to each other, keeping in consideration of social distancing as extremely important, and the use of PPEs. Generally speaking, again, we all know how to protect ourselves and everybody that is around us. Of course, staff and patient education is of paramount importance. Then we have all these devices that help us: protective screens, social distancing, sanitation, protective equipment, separation. And another important point is decrease the exposure by shifting work. So every appointment is strictly respected in terms of time, and avoiding patients to stay in the waiting room. So respect very strictly time and the use of telemedicine as much as possible. I was mentioning education, and education is not only know how to behave when we enter our clinic or our hospital, and not only to know how to behave when we leave the clinic, but it's extremely important to have a code of conduct also outside of our working environment, because we have to keep in mind that we have to be responsible in our behavior, not only when we are in our working environment, but also when we go outside, because we have a duty towards the others and the others have a duty towards us. So if it is true that we have to tell our patient how to behave, but it's important that the staff does the same, and also everybody that enters our environment, going from contractors to accompanying person, that actually we strongly discourage unless necessary, and everybody that enters in contact with our environment, and how to approach this code of conduct. The first thing is how to think, to define which are the risk factors. Of course, busy places are the top risk situations. So we have to try to avoid going into strict contact in very crowded places. And of course, how to put this in practice. Again, wash your hands, use facial mask, and try to avoid these crowded places with the aim of keeping the risk of infection as low as possible. In other words, we have to think in a different way. As Ahmet was saying before, nobody is going to be, even in the far future, I'm afraid, the same as it used to be. So now we have to learn. We have to start thinking differently. We have to learn from this situation and to take individual responsibility, because if we educate and we behave accordingly to this code of conduct, then we are going to have a special funneling risk of infection, that if we do it everything in the proper way, the risk is going to be very low. And this bring this code of conduct in a very priority for all our reality, because it's a matter of all being affected if one is breaking the conduct. So that's extremely important for us. Last point that I want to mention is that everything that I presented to you until now is the result of the joint effort of the COVID group of Eshre, has been now shared by the three most relevant reproductive medicine society. So ASRM, Eshre, and IFFS produced a joint document. You can also find it on our website. I think it's very important, this document, because we start from the principle that reproduction is an essential human right that transcends any difference. So reproduction is important because we know that infertility is time sensitive. So now it is our duty to restart ART treatment, of course, following the precaution measures that are summarized in this document, but are practically the same as as I was discussing before. Also keeping in mind that more research is needed and more evaluation of what happened, of the cases that are reported, because as we were saying, nobody tells us that this won't happen again. Of course, hopefully not, but who knows? We have to learn from this. So let's see the positive side of the situation is an additional occasion to learn. And this is also in the aim of the Eshre annual meeting. You certainly know, the majority of you, that this meeting that was supposed to happen in Copenhagen was cancelled as a physical meeting, but is being translated into a virtual meeting. So a situation like this one that we are doing today, and there will be this program will be practically the same as the one that was supposed to be in Copenhagen, developing in 4 days. All the information is available in our website, and there will be an open lecture and 2 sessions also on the COVID-19 situation and pandemic, seen from the different aspects. Remember that the registration is completely free for Eshre members, and we really hope to see you all there, because it will be important to keep our spirit alive and to keep staying together. So I thank you again for the kind invitation, and thank you to those that listened to my words. So thank you, and keep enjoying the meeting.
Cristina, thank you very much for this very thorough information, and I believe that it will be very helpful for the practitioners. And I also believe that we will meet each other in the Eshre Congress, which will be the first digital Congress of Eshre. And thank you very much to be with us here. And now I'm shifting to the Turkish version. Thank you again.
Okay, thank you. Thank you. Bye.